Well, I'm very pleased to be able to speak to you today about medicinal marijuana. And part of the reason is that I work at the Complex Pain Center at St. Paul's Hospital, and we've been using cannabinoids for the last 15 years, getting some repeat. For the last 15 years for some patients with really difficult complex pain issues, and have had fairly significant results. The important thing to know is that medicinal marijuana is not a panacea, but it's one more tool to help those of us who are working with people with incapacitating pain, be it from a malignancy or non-malignant pain. This is my email. Please write it down. I have a very large amount of material in this talk. Normally I at least spend an hour and a half educating physicians with similar material, and we're going to be crammed into 30 minutes. So you need to put on your track shoes, but if your questions aren't answered, please don't hesitate to email me. I'll be more than pleased to respond to you. I only work Tuesdays, Wednesdays, and Thursdays, so if you happen to email me on a Friday, you may not hear for a couple of days. So I really want to stretch your minds today. I want to give you a new way of looking at some of the myths that exist regarding marijuana. Chronic pain is a major problem, a much bigger problem than even the slide suggests. It's estimated that perhaps as many as 20% of the Canadian population suffer from chronic pain that impairs their quality of life. How many people here have chronic pain or know a family member or friend that's incapacitated or affected by chronic pain? Everybody. And the type of pain that we have most difficulty managing is the pain that comes from injury to the nervous system. And we call that neuropathic pain. And we have a variety of different strategies, which I'm going to talk about. But in some cases, patients are left suffering and still have real difficulty, or they can't tolerate the treatments. And so as a consequence, it's actually patients that have come to us requesting the use of marijuana medicinally. Many of them have tried it recreationally, or a friend has advised for them, and they found it was helpful in the management of their symptoms. So why is it that chronic pain is so difficult to manage, be it whatever the cause, whether it's a non-malignant or malignant cause? Well, the reason is it has to do with our evolution. Can you guess which one's me? Over the millennia, over the thousands and thousands of years that we've been on Earth, our nervous systems have been modified in order to ensure that the pain message would get to us, because it's our emergency signal would get to into our consciousness. And so as a consequence, we've developed many different neural pathways and neurotransmitters in order to ensure that that message can get to the brain. The difficulty is that if we don't manage that pain, if we don't control that pain, it can go on to some very serious consequences with escalating pain, and it begins to affect the whole person with mood difficulty, sleep disorder, inability to think clearly, fatigue, and affecting their ability to be productive and their quality of life. So we do have many different strategies for managing chronic pain, and one thing we're all most familiar with is the pharmacology, and we have a number of different medications, but they're like a double-edged sword. On one side of the sword is the benefits. On the other side are the adverse effects. And the difficulty is that many patients have significant adverse effects such they can't tolerate the medication and can't get benefit. What we've learned as the specialty of pain medicine has evolved, that many of these different agents, if they're used together in combination, we can use smaller doses and they work symbiotically. They work more effectively than any one of the drugs alone. Some people think they're being treated like a guinea pig when they go to the doctor and they're offered a variety of different medications. But for chronic pain, that's often necessary. One of the advantages, as you'll see, about medicinal marijuana is that it's a very safe drug, and we'll talk about that shortly. And side effects people develop tolerance to rather quickly. Oh, what's this? Oh. Colorful culture develops colorful language. This is a doobie. This is a reefer, a joint, a weed, and in Hawaii, a Maui Wowie. Part of the difficulty, though, with the culture is because marijuana is being used recreationally, it's got a bad rep. But actually, marijuana is being used for over 5,000 years for pain and symptom control in Egypt as well as in China. So what's the science? Do we have all the answers? No, we don't have all the answers, but we have far more knowledge than we used to. We now have many very well conducted scientific studies that in fact proven that marijuana is safe and it's efficacious. We used to have to depend on anecdotal studies, and so often physicians would say, well, there's no good evidence about this being effective, but now we can point to a number of, quite a large number of studies as well. Now, how many of you people here, how many here have the breakdown products of cannabinoids in them right now? We all do, absolutely. Dr. Hawley knows, and the reason is because just like we have an morphine type system where we make endorphins for reward, like when we feel good, we run hard, we have intimacy, we ate a great meal, we have a release of these endorphins, little chemicals that go to receptors in our brain and other parts of our body, like a lock and key, and they give us a good feeling. The endorphin system is parallel, but it has far more impact on the body functioning than the endorphin system. The cannabinoid system is very widely distributed and controls many, many body functions. In fact, it's thought to be responsible for homeostasis, the maintenance of balance in our body. Big word, but I think you're going to follow me there. The endogenous system has chemicals we call endocannabinoids. And there are many, but the three major ones are listed. And they're produced by the body, and they act on the cannabinoid receptors, just like the opioids work on the opioid receptors. These are the little places in the body where the cannabinoids connect and have their impact. Similar effect to marijuana, but a little less potent. And we have two types of receptors. We have peripheral receptor, or central receptors in the nervous system, the CB1, and we have CB2 receptors more in the periphery. This diagram shows you the concentration of the CB1, and you can see that it's widespread in the brain stem, spinal cord, and even out into the receptors in our periphery. The CB1 receptors are mainly in the nervous system, whereas the CB2 receptors are primarily in the immune system, like in the spleen, tonsil, and mast cells. The CB1 receptors are extraordinarily abundant in the brain. We have 10 times more of the CB1 receptors than we have of the opioid receptors. Isn't that amazing? And, but what's really important is there aren't very many receptors in the cardiorespiratory center, where we control our heart rate and respiratory. And therefore, it's extremely hard to have an overdose from a cannabinoid or marijuana, whereas it's very easy to have an overdose from an opioid. You would have to consume 1,500 pounds of marijuana in 15 minutes to die from marijuana. You would have to smoke 900 joints all at once in order to die from marijuana. Very safe drug. So there are very widespread functions. Just to touch on this, it affects our memory, sleep, appetite, our metabolism, pain perception and modulation, stress response, and balance of excitatory and calming effects in the body, and intestinal motility, to name a few. So the cannabinoid system is extremely important in body function. And if you're deficient in the endocannabinoid system, there's such a condition called an endocannabinoid insufficiency syndrome. And that's where people don't have enough cannabinoids happening, and they are less able to buffer stress, And we believe that that's an important precursor of mood disorders like anxiety, depression, post-traumatic stress disorder, and some of the other functional disorders like fibromyalgia. You may know people with fibromyalgia or irritable bowel syndrome. So you can see this is a very amazing system. Let's hit the right button, David. Okay, so I've just been talking about the endocannabinoid system. I now want to talk to you about the external cannabinoids. Now, they can be naturally occurring like marijuana, or they can be synthetically manufactured as drugs. Nabilone, Sesamet, Sativex, there's a number. We're going to talk about marijuana because that's the name of the talk. Marijuana comes in primarily two plants. There's three, but the two important ones are sativa, which has got narrow leaves and is activating, and indica, which has got fat leaves and is more calming. The marijuana is only produced by the female plant when it's mature, and it develops on the ends of the buds in tiny little spherules. It doesn't occur in the leaves or the stalks. It does occur a little less on some guarding leaves. But if you talk to the people that have smoked marijuana all their life for recreational purposes, they're always chopping up their stems and their leaves, but there isn't any marijuana there. So that's the placebo effect. So the two main cannabinoids from marijuana are CBD, which stands for cannabidiol, and it's non-psychoactive. And THC, tetrahydrocannabidiol, I always have trouble getting that one out. It is psychoactive. No, I'm not taking any. And I don't have any samples for anybody. What's really important is the ratio between the THC and the CBD. The ratio determines the effects it has on the body. Typically, most people with chronic pain aren't interested in getting high, so they typically want lower THC levels, and we always start with lower THC levels in that group. And you can see that when I'm talking to the doctors, we talk about a low THC level of less than 9%, and now it can be down to 4 or 3%. It can be very low. But you have to have that combination. And that combination will determine what effect it has on the individual, but also the effect it will have on different conditions, like multiple sclerosis or cerebral palsy or a variety of other medical conditions. And we're in the process of trying to figure out what are the best ratios for what condition. So that's where these licensed producers, there's 26 of them in Canada, they're regulated by Health Canada, produce and selectively different strains of marijuana to try to meet and find the sweet spot for patients' best response. The street varieties are quite high in THC, no question. Recreational users want the bump. In 1983, the concentration of THC was about 3.5%. Today, it can be as high as 27% or higher. So, yeah, that's what people are using. The clinical evidence that I talked about, there are many, many now randomly controlled trials. If you look at this diagram on the far left, where it's hardly able to see anything, that represents a handful of studies that were published in 1963, whereas out on the right here, 2008, more than 1,500 published studies in Index Medicus. And, but most importantly is the quality of the science. And the randomly controlled trials indicate that it's safe and it's efficacious. So and when they do a meta-analysis, they look at all the different random controlled trials. And the conclusion is, one, it's human pain will respond to marijuana. The effect is moderate, so it's not the panacea. And there's more studies are needed, but definitely it has a role. So how do we use it in chronic pain? These are the benefits of marijuana, where the opiates primarily just affect the pain receptors, some other peripheral effects, but mainly the pain receptors. Cannabinoids will decrease pain in their own right. If you're on an opiate medication, it will reduce the need for as much opiate. It augments the opiate. And the advantage of that is you need less of the opiate, so you have less adverse side effects, less tolerance, less other problems. It decreases muscle spasticity. So patients with MS, any people that are having a lot of muscle spasm, it can be helpful there. It's calming. Most people that have severe pain are anxious, and so it has a benefit. It's an anti-anxiolytic. It's anti-nauseant. Many of the medicines we use for a variety of treatments in cancer as well as others are nauseating, and cannabinoids can be helpful. And it's also an anti-inflammatory. Now everybody here has taken Aleve and Advil, and well, those are anti-inflammatories. Naproxen's a little stronger. Cannabinoids are 10 times stronger than aspirin and 2 times stronger than the NSAIDs, or these anti-inflammatories, and there's no risk of GI bleeding. Everybody wants them? So these are the indications that we use to determine whether a patient would be effective and be managed with a cannabinoid if they're not responding to other therapy. So neuropathic pain, muscle spasticity, cancer-related pain, palliative care, PTSD, and anxiety, all those conditions have randomized controlled trials that have proven the efficacy, but we're using it in other conditions like arthritis, fibromyalgia, etc. So, what are the contraindications? Why should you not necessarily be on it, or you need to be watched very closely? History of psychosis, history of drug or alcohol addiction, severe liver dysfunction, use with other psychoactive drugs, particularly sedatives or hypnotics or benzos, because they're an additive effect. And we have to carefully monitor people that have depression and anxiety, but almost everybody who has chronic pain has some mood disturbance because they've had losses, they can't be productive, and it's very common to have adjustment reactions to it. Absolute contraindications, known sensitivity, uncontrolled blood pressure or arrhythmia, meaning their heart rate is irregular. Marijuana in some people will increase the blood pressure more, and some people will drop the blood pressure. Marijuana in some people will raise the pulse, other people will lower the pulse. So those are the conditions that we don't recommend its use. And chronic hepatitis, it's thought it can cause fatty liver. Schizophrenia, it's been shown that if a person, 15, starts smoking marijuana and they have a strong family history of schizophrenia, there's 4 times the likelihood of that person developing schizophrenia by age 26. Pregnancy, and go without saying. These are the common side effects. I don't know if you can read it on your in the booklet, but you can notice the most common ones are, and I gotta get my glasses out here, sedation, dizziness, and somnolence. The good news is if we start the dose very low and we only gradually increase, patients will develop tolerance to these side effects. So it won't prohibit the use of the medication. Some people can get a little postural hypotension. That means if you sit up, you're sitting and you stand up suddenly, you can feel lightheaded. So that's common. Red eyes and a dry mouth. Those are the commonest things. And you can see there's less common and quite rare conditions. But those are the things I wanted to point out to you. In terms of many other medications we use, those side effects are relatively low and less impact. Now, what about driving? Marijuana and driving. Well, actually, believe it or not, the studies show that marijuana has a relatively small impact on driving. What they have noticed is that people tend to drive inappropriately slowly. But the problem is that people that are using marijuana recreationally typically use other things too, and the problem is those are additive. Alcohol, any other kind of psychoactive drug can impact on the marijuana and lead to severe impairment. Overall, as I've mentioned, the acute toxicity is low. No one's actually died from, there's no recorded case that I'm aware of in the literature where someone's actually died of an acute overdose of marijuana alone. So it's safe. What are the long-term effects? Well, dependency is one factor, but when you look at statistics in the general population, 9% of the general population can become habituated to marijuana, 10% to opiates, 15% to alcohol, 17% to cocaine, and 32% to smoking. All the smokers in the room have to stop smoking. Cognitive effects, it can be impaired if you've been a heavy user, but that usually is resolved after about a month. I mentioned about mental illness, psychosis, and schizophrenia. Immunity, we don't know what effect it has on immunity at the present time. And pregnancy, it has a significant effect. There are problems with people that abuse marijuana. And how do you identify these people? Heavy daily smoking, excess time and money spent on using, impaired work and school performance, dysfunctional social relationships, and repeated attempts to quit or reduce use. The people that are most likely at risk for substance abuse disorder are young people with using other substances and have a mental disorder as well, like some kind of a personality disorder, depression, whatever. How do we use it? Everybody kind of knows you can use marijuana. You can use it by inhalation. We can use it by topicals, and we can use it by ingestion. The guidelines for smoke marijuana, typically everybody's a little bit different, but you can see that we start off at a very low dose. An inhalation of 50 milligrams. This would be in a vaporizer, I'm talking later, but typically we start low and go slow with a very low THC. The average is about 1 to 3 grams in 24 hours, but many, the BC Cancer Agency did an interesting study on the use of marijuana, and 20% of those patients were using under 1 gram. I think 10% were using, 50% were using between 1 and 5 grams, and then 10% were using between 5 and 10 grams, and 20% were using over 10 grams a day. That would be like 20 joints. Who do you think that population belonged to? Those are the recreational users who are needing marijuana for pain relieving effects. So they already developed tolerance to the marijuana, and consequently have needed a higher dose to get benefit. Another reason for starting low. If you are smoking, you shouldn't drive a car for at least 4 hours, and if you have euphoria, it's recommended you don't drive the car for 5 hours. Vaporizing is a much safer way of inhaling marijuana. It's basically it's much smoother, much less irritating, and the reason is because it's the heat that releases the biological activity of the marijuana, and basically at 175 degrees it starts to form this vapor, but it's not in combustion. And as you increase the heat, you release more of the THC and the CBD. And so when you're starting and advising a patient to use an inhalation, they should start at the lower temperatures, and all the new vaporizers roughly are good ones have a temperature gauge so they can adjust that. The advantage also is that you avoid at least 90% of the carcinogens. When you inhale a joint, well, you guys inhale a joint, you're getting over 300 chemicals, and some of those are carcinogenic. Brownies. Okay. So we're going to turn to dosing with ingested marijuana. It's an alternative to respiratory. People that are having sudden jolts of really severe neuropathic pain often will recommend they use the inhalation form because they get almost some immediate relief within about 5 minutes. When you ingest it, it will be variably absorbed. If you have a full stomach, it's going to take longer. Different people's guts operate differently, but generally it's a slower onset. And the problem is when people are naive with marijuana, they take a brownie, it tastes good, nothing's happening. Oh, maybe I need another one, or another one. And you know, some of these people end up with emergency with tachycardia. So yeah, it's got to, you wait till you get the full effect, and then don't take it more until it happens. It can last up to about 12 hours, so typically people that are ingesting marijuana shouldn't be driving until 12 hours after. And obviously, because it's not as a direct absorption system, it often requires a larger dose of the cannabis. So what about the regulations? That's a real hodgepodge. But basically, federal law prohibits the use of marijuana unless it's authorized. The most recent legislation came down in March of 2014, and it's called the MMPR, Marijuana for Medical Purposes Regulations. There's a couple that are confusing. The trouble is it's quite confusing for physicians, and it's very confusing for patients. Now that the government's planning to, or says it's planning to legalize marijuana, we're not sure where we are at, but under the current regulations, people can only really, theoretically, should only be buying from, directly from a licensed producer. The licensed producer must be licensed by Health Canada, and they have very rigorous standards. They have spot checks on them. I've been to a couple of facilities. I take all my clothes off, have a shower, put on their clothes. It was more sterile than an operating room, actually. They can't use chemicals, and they have to and they have to guarantee that there's no fungus or pesticides in their product. And they also have to specifically state the amount of THC and CBD in their product. Well, when you go to a dispensary, you don't know what the heck you're getting. So that is definitely there's something to say about the licensed producers. The dispensaries and the compassion clubs are not legal, but the police at the present time are not acting on it. And physicians and nurse practitioners do not disclose symptoms or medical conditions on the medical document that they send to the licensed producer. So this is all between you and your healthcare provider. So basically, the patient's benefits now, patient can get the medication very quickly. A patient that is palliative and at home and has requested marijuana and will have a vaporizer and product in their hand in 3 days. So it's really quite amazing. And as I've met, you can see that there's definitely quality control. That's an advantage to the patient. And patients get to know, or people get to know what their active cannabinoids are in their product. And there's less home fires. Well, how about that? What are the downsides? It's really the jury's out, but it's thought that the new products are more expensive, but it depends. Some dispensaries are jacking their prices. There's a lot of competition between licensed producers, so I think the prices are coming down for them. They have compassionate rates for people that can't afford it, or for senior people. I'm only 35 inside. This is a document that I recommend if you're interested in this topic that you get it. It's online, and it will give you a lot more details than I've given you today. And I just want to let you know that when I give this talk to physicians, I tell them, look guys, we've got to take our head out of the sand because medicinal marijuana is here to stay, and it has some very good benefits for patients that they should be able to access. And if you as a doctor don't want to prescribe it, it behooves you to ensure that your patient is in touch with some physician that is prepared to help them. Thank you.
Brilliant.